Hi, my name is Alice and I'm a clinical nurse specialist and art therapist working in the child and adolescent mental health services. When I was a nurse working within the services, I realised that there was a deficit in ways of allowing people to communicate, and we really focused on speaking about things that were difficult and things that people may be finding distressing or troubling. And so I got my master's in art therapy as a way of bringing in a different way of communicating, of allowing young people to communicate. So this would be through the use of art media and making and creating within a therapeutic session and within a therapeutic relationship with a trained therapist. Well, first I suppose that I'd meet you and your family, and we would discuss whether we think art therapy would be a really good fit for you and whether you think it would be something that you would like to engage with. I suppose what's really important in this stage is that I would let you know that there's no prior need for any art experience necessary. So the aim is that we will explore together using different sort of mediums. We have lots of those available. So it's not about being good at art. It's not about drawing pretty pictures. And it's, I suppose, a little bit more than just drawing our feelings as well. It's about self-expression. It can be about play. And it really, it's part of a safe environment in a safe relationship with the therapist. If you came in to see me with your family, I would meet with you and your family first. And then I would meet you on your own and just talk about what it is that we might be doing. So what we usually would do would offer 6 sessions, and then we'd review. And you can discuss then whether you would like your parent or guardian to come in and discuss anything that we've discussed in the sessions. I suppose your artwork is kept confidential and secure within the art therapy environment. It's locked. We try to keep your artwork safe throughout the time that you're attending art therapy. It's fun. It's, I suppose there can be a lot of play, there can be movement, we can do breath work. I suppose breath work is a really good way to come in to start a session, can help you to relax, and then it's something that you can bring with you throughout the rest of your day. You know, if you're beginning to feel a little bit stressed going into another situation, then maybe you can remember the breath work that we did at the start of this therapy session. Also the different modalities and things, you know, there's different textures, lots of different materials. We have sand play, we use a lot of paint. You can do messy things, we can make slime. Really it's up to the individual, so it is the service user or the young person who really drives the therapy sessions. And then the therapist is really the guide, that's sort of holding the safe space for the young person to be able to explore what it is that's going on for them, and to see maybe how we can help to overcome this or look at different ways of coping with this, or even sometimes just getting it out there, I think can be really important, because if you've had something inside for so long that you haven't been able to express and you just haven't been able to get it out, sometimes putting pen to paper or having an image created from a session where you can be like, wow, Jesus, this is, I can't believe that I'm sort of seeing this in a visual. And that can be a really empowering for people. And it can be, just really, really helpful. So it was in this safe space, the art therapy session is a container for these kind of things. So, whatever comes up is being contained within the session then. Well, I suppose art therapy can help you throughout your recovery journey. This can be from the start, maybe when you're in crisis, or towards the end when we're looking at more kind of discharge processing. So I suppose in crisis stages, the art therapy can be just a really gentle and supportive way of allowing you to express what it is that's going on for you. And you don't have to verbalize it, and I think that's what's most important. So talking is of course always welcome throughout sessions, but what's the most important part of art therapy is that we don't need to verbalize if we don't need to, and we can verbalize through so many different other means, through our body language and through art pieces that we create within our sessions. The role of an art therapist offers you with a different way of expressing yourself that doesn't have to focus on verbalizing your thoughts and feelings and things that are going on. It can also offer you an opportunity to explore things that may be sort of in the peripheral of your understanding, so they can kind of come in through art making and become concrete. So an example of this would be things that maybe you hadn't realised had been distressing you throughout your day may come up within an art therapy session. And that this may not have ever come up if we were focusing purely on verbalising what's going on for you. Yeah, so you can access art therapy through your mental health team, and you can also ask your GP for a referral to community art therapy services. So there is, art therapy is widely available in the community, but it really is an emerging role within the mental health services.